Hi, my name is Naima Lawson, and the date is November the 1st. The time is 1:13, and today I will be administrating a Foley catheter on a female patient. Prior to walking into the room, I've already got all of my materials. I'm going to walk in, I've already washed my hands, make privacy for my patient, and then I'm going to introduce myself to my patient. Hi, my name is Naima Lawson. I'm going to be your student nurse today. Can you please state your name and date of birth? Okay, great. Today we'll be doing a Foley catheter. Have you ever had a Foley catheter before? She states no. And then I'm going to ask her about her last urination. She says it was 2 days ago, so she is ready for the procedure. I'm going to roll this back. I'm going to move my patient up a little bit. And then I'm going to adjust my patient. While I'm adjusting, I'm going to make sure that my patient doesn't have any residue on their private area. She does not, so she's okay. Next, I'm going to wash my hands. And I'm going to start setting up my sterile field. I also brought a bed blanket for a little bit of extra comfort for my patient. Okay, I'm going to take my trash bag, and that'll be used for all of my trash for the bed. This is not sterile, so I'm going to be able to touch the edges and open it up. Making sure they don't flap back. Then I'm going to take my waterproof drape, shiny side down. I'm going to be very careful. I'm going to stick it underneath my patient. Next, I'm going to put on my sterile gloves. I'm not going to face my sterile field. Open my gloves first, facing away from me. And then once my sterile gloves are on, I can fix my other hand. Great. So then I'm going to hold these above my waist, and I can start preparing for the Foley catheter. I do not need this portion because this is for the male. I can open my swab sticks. These gloves did not fit, so I'm going to put those to the side. And I'm going to pick up this tray. I'm not going to use the iodine for my patient, so instead I'm going to use the swab sticks. And then I'm going to test out my catheter. I'm going to look at the syringe, and there's 10 millimeters, so when I return it, there should be 10 millimeters back. Take the top off. And I'm just going to test out to make sure that my balloon works. Okay, perfect. So it filled all the way up. I'm going to take it back out and let gravity pull out all of my solution. Great, so I'm going to leave that there. Next, I'm going to take my lubricant, place it anywhere on this clear area. So now that I have my lubricant set up, I'm going to be able to start cleaning my patient. I know that when I start cleaning my patient, my non-dominant hand is not going to be sterile anymore, so I cannot use it for the procedure. I'm going to start with the outside. Toss it. Around the inside. And then I'm going to do one swipe down the middle. Just like that. Next, I cannot move my hand, so I'm going to take my tube and I'm going to lubricate it very well. Like so. And then I'm going to open the flaps, holding it back. And then I'm going to tell my patient to exhale, 1, 2, 3. And I'm going to just walk my fingers in, sticking it about 2 to 3 inches in, or till I meet resistance. Now that I know that this is not going to go any further, I'm going to put the 10 milliliters into the Foley catheter to inflate the balloon. And I'm going to unhook my syringe, and then I'm going to pull back until I meet some resistance. Alright. At this time, I can take off my sterile gloves. I can wash my hands again, And then I can put on new gloves to hook the catheter to her legs, but in this case we're not. We're just going to take the catheter bag and place it on the side bed railing. Now at this point I would document that the urine is flowing out. I would document how much milliliters I put into the Foley catheter, what time I did, what color of the urine, and that's it. Thank you. Okay, so now I'm going to go back into my patient's room because we're ready to remove the catheter. I'm going to wash my hands, and I'm going to explain the procedure. Hi, my name is Naima Lawson. I will be your student nurse today. Can you please verify your name and date of birth? Okay, great. Today we're going to take out your catheter. This is a clean procedure, not a sterile procedure, so I'm going to put on clean gloves. And then I have my syringe ready. So I'm going to first take my syringe, place it, and I'm just going to let gravity pull back all of the solution. I noted before that the solution should be 10 milliliters, so that's how much it should return. Okay, great. So it's 10 milliliters. Then I'm going to tell my patient 1, 2, 3, and exhale, pulling it out. And wrap the catheter in my glove. And at this point, I would throw this away. I would document that 10 milliliters came out, and I would document how much urine was in the bag. Thank you.